Inserting an indwelling catheter into a female. Check physician's order. Check client's identiband and, if able, have client state name. Explain procedure to client. Provide privacy. Gather equipment. Assist client to position knees up and out. Open sterile package by tearing package. Place plastic wrap at foot of bed for waste disposal. Place catheter tray on bed between client's legs. Expose perineum. Open white outer wrap away from package. With last turn toward client. Position sterile absorbent pad, plastic side down, under client's buttocks. Have client lift buttocks if able. Position pad by holding corners of pad only. Don sterile gloves. Separate the two containers. Place container with cotton balls and lubricant toward client. Place container with catheter and bag toward foot of bed next to first container. Open package and pour antiseptic solution over cotton balls. Remove rubber protector and insert tip of the pre-filled syringe into catheter side arm. Test balloon by inflating. Pull back on syringe to remove fluid after testing balloon. Lubricate catheter, then return catheter to tray. Position fenestrated drape over the client to expose the genitalia. Separated the client's labia minora with non-dominant hand. With dominant hand, use forceps to pick up an absorbent ball that has been saturated with antiseptic solution. Cleanse client's meatus with one downward stroke of forceps or swab. Discard absorbent ball in plastic bag at foot of bed, being careful not to cross over sterile field. Repeat above step at least 3 to 4 times. Continue to hold client's labia apart until catheter inserted. Discard forceps and plastic bag at foot of bed. Take catheter from tray with uncontaminated hand and insert gently into meatus, 2 to 3 inches, or until urine starts to flow. Guide catheter gently just beyond point at which urine begins to flow. Inject entire contents of pre-filled syringe into side arm of catheter used for balloon inflation. Note, if client complains of pain on inflation of balloon, immediately aspirate sterile water. Retract catheter until resistance is felt. After taping catheter to client's thigh, arrange tubing to allow free gravity flow of urine. Attach drainage bag to bed frame, not side rails. Cleanse client's perineum of antiseptic solution. Remove drapes. Reposition client for comfort. Put bed in low position. Remove and discard disposable supplies in appropriate container. Wash hands. Document procedure. Measure and record urine output on I&O bedside record.